Hi. So, in this episode, we are talking about natural healing and what that means. We're going to talk about different modalities and therapies that are used in natural healing and why that is so important to us, why we think that this is really the way nature intended us to handle all sorts of different illnesses, chronic and acute. And so, that's what Daniel and I will be talking about. So, Daniel, how would you define natural healing?
Well, I think there's a lot of misunderstanding around natural healing because of the modern medical system. A lot of people they say, okay, my blood pressure is high, so I take lisinopril or something like that. Or if they go to the herbal world, they go, well, if you have high blood pressure, you could take cayenne pepper. And so a lot of people use herbs to treat symptoms like they would medical drugs. But in my opinion, the true world of natural healing is we treat the whole body. Not only do we use specific herbs for a disease, but we also change the diet to a raw plant-based diet. We cleanse the colon, we cleanse the kidneys and the liver, the gallbladder. We don't focus on the disease. We focus on building the health of the body to such a high degree that the body can heal itself. That's the way I look at natural healing. That's why it's so different from the modern medical system of just treating symptoms.
Yeah, I can totally agree with all of that. And someone's sick and they go to the doctor and they don't tell them to change anything else about them. You just take this pill and that's going to help with your blood pressure. And they don't even look at, what led to the blood pressure. And then there are all these side effects. And so I know a lot of people that I've worked with, they're on so many drugs, and this one is to counteract that one. And they're not fixing anything. They're just getting worse and worse. The dosages go up and up. And so I think that's one of the reasons why this is so important to me. Let's find out what's causing the blood pressure and work on everything
Yeah,
that's causing it.
it's in
Hmm.
the same model. You'll never get better, and the more the drug you take, the more toxic and the more side effects that you could potentially get.
Right.
And I don't know.
Yeah. Well, then I also have a lot of people that will come to me that will think that, that this is, well, even in my own case, I received a diagnosis and this is it for life, you know?
Yeah,
Yeah, and there's no turning back. And in almost all cases, there is a way to at least maintain where you are and sometimes even reverse, like type 2 diabetes.
oh yeah.
There's so many doctors and people out there saying that you can't reverse it, and you can't, once you have it, that's it. And that's not true. That's not true.
Yeah, and there's a
Yeah,
whole other population of people that are reversing it. Doctors or some of the plant-based doctors, they're reversing type 2 diabetes. Then you
right.
go to another doctor, he's like, no, that's not possible. It's like,
Yeah,
why there's such a, I don't understand the miscommunication. I
right,
don't know.
right.
Um,
Well, I think too, for us, in the natural healing world, we look at the whole body, mind, and spirit.
yeah,
And in conventional medicine, they're just looking at one body part. They don't really pay attention to how other things affect this body part, and even how energy affects different body parts too. It's just, you have, well, I keep going to high blood pressure, but you have high blood pressure. It's just your heart. You're just working harder. Let's just, it's working harder for a reason.
yeah.
you know, Hello, it's because something's wrong. It's got to work harder.
Well, I mean, speaking of that again, there was a study out of UAB a few years ago. It found that people who had a blood pressure of 160 over 90 that was untreated compared to a group that was on 4 different blood pressure drugs. The
Mhm.
group on the 4 different blood pressure drugs had a 40% greater increased risk of heart attack and stroke than the group that was untreated. And this is at UAB in
Yeah,
Birmingham.
yeah,
And,
yeah.
but you go to the doctor that like that say this and exist, and we're just going to keep throwing drugs at you, and we don't. It doesn't matter what you eat or if you exercise or what about our emotional states, man? Like stress,
Yes,
man.
yes, yes.
Unhappiness.
Right.
You got to
Yes.
address all these things. I look at the medical system as for people. I don't want to offend people, but a lot of people don't want to change their lifestyle. They want to take a pill, and then it makes them feel okay. Well, now that I take this pill, I can still live on the couch, eat pizza. I don't have to exercise. I don't have to address my childhood trauma. You know what I mean? And it's just,
Right.
that's a lie. It's a lie, you know?
Right. It is. And you know what? It is not easy, then going the natural healing route.
Oh
It's not
no.
easy. Like I remember Dr. Schultz saying patience. It was like the key that you have to have
Yes.
patience. And I think that, in the world we're living in is so fast paced and go, go, go. And I have to get more and more done every day. And I think that the pill, you know, give me a pill to help. I've had, I know someone who has a lot of pain,
Yeah.
and we worked on, we did gluten free, raw
Yeah.
vegan for a while. And 3 months later, oh, it's amazing. I just feel so much better. I have no pain. And then 6 months later, I was talking to her, and her pain was just excruciating. And I said, well, are you still, gluten free and the raw vegan? And she said, no, I felt so good when I was doing that. But now, I'm just taking these pills. And I said, well, you're telling me you felt better doing that. Why are you taking, well, it's just a different kind of pain now. And it might be worth it to try. I know it's hard. Sometimes it's hard. If let's say like I'm 50 years old, you're 50 years old and 45 years of your life you eat gluten and dairy and all of these things. And then to change, 3 months, okay, I can do it. But to go long term, it's like you have 45 years of habits and emotions tied to our food, traditions. Like we're coming into the holidays now, and
Oh
it's,
yeah.
how do I not have my special food? I want my special food. But you have to weigh it too. Is it worth it to take medications that are going to cause these side effects?
And
You know,
yeah, a lot of these medication, not only do they cause side effects, but eventually they can destroy your health. They can
right.
cause organ damage. They can cause cancer. But another thing around the food you're talking about is, not only does it take discipline to change, but food is, like you're saying, it's very tradition driven.
Yes.
Friends. I mean, I lost a lot of friends when I went plant-based, you know?
Right. Right. Yeah.
It's
You stop getting invited over to things, and
yeah.
you're no
And
longer
it's
getting invited to go out to eat and stuff. Or when you're with the group, they'll say, well, where can you go? Or what can you eat? And
yes.
everybody's like trying to arrange everything around you and your food. And that's
Yeah,
hard.
you turn out to be the weird person. And it's not only is it willpower, but it is you don't want to be left out of the social circle. And it's important to have a social life.
Hmm.
But what you really, I guess, you just have to find other people that are doing what you're doing now,
Right.
even though it's not easy when you, especially if you're on even a plant-based diet. But if you go on a raw plant-based diet, it's even harder. It's like you got
Right.
your cooked vegans over here, and then the cooked vegans look down at the raw vegans. It's like,
Yes. Yeah. Well, and
oh,
then I know for me, I can find places that are gluten free, or I
yeah,
can find places that are vegan, but I can't find places that are gluten free vegan.
no,
Yeah. And
no.
so it's like the lousy lettuce, iceberg lettuce with a couple of slices of tomato and cucumber. That's your lunch. And it's like,
It is
okay.
like $15
Mhm. Yeah.
if you go get it at a restaurant.
Yeah. I guess I'm fasting today.
Yeah.
Yeah, which is good and healthy too.
Oh yeah.
In some cases,
Yeah,
yes.
yeah, yeah.
Yeah.
But really,
Um,
what you're saying, the point is though, if you can heal your body of something where but yeah, we keep going back to blood pressure, but let's say the body raises blood pressure for a reason. You may have clogged arteries, it may be stress, it may be you're too heavy. The drug just suppresses the symptom, but the disease process is still ongoing.
mhm,
The doctors don't tell you this, even if you're on metformin for diabetes, the blood sugar is still damaging the body because you haven't addressed the cause.
right,
But but you're told, well, my numbers are good though.
right,
It's
right.
artificial though. It's an illusion.
It lets me eat the crap because I
Yeah.
still get the numbers that I need to get, which you don't see the underlying damage that's occurring. That reminds me. So this is not natural healing, but a year ago I did the Zoe test. Have you heard of Zoe?
I haven't.
So
Oh, yeah, I have.
you do a stool test. You wear a um continual glucose monitor,
Yeah.
and you also do a blood plasma test, and they see how your body responds to sugar and fat.
Yeah.
And so I did it. I was so curious. And it teaches you how to combine foods so that you get the number that you want. And it
Wow.
tells you, you can eat whatever you want. And so during you test, you do these test days where you eat a piece of bread alone and see what happens. You eat a piece of bread with avocado and see what happens, or cheese, you know, bread with fat. But and my point is, you're eating fat, you're eating bread, you're eating muffins. They actually mail you these muffins that you eat to see how your body handles the muffins. And so they're showing you how you can eat the muffin and the bread and all of this and still get the Zoe score. And the Zoe score is something like, I want to say your goal is like a 50 for the day. And,
Yeah.
and so I was comparing that to what I consider a healthier diet. And so I could eat, you know, I don't know, bread with butter and cheese and get, a 50, or I could eat, avocado with I could make a green smoothie, with
Yeah.
avocado and berries, and I could get 100.
Oh,
Well,
wow.
why are we teaching people to get a 50? Your goal today should be a 50, like,
So they had to take the medication. It's a business. It's a business.
yeah,
They have
yeah,
to make money. That sounds
right.
like a really cool, that test would be very, um, what am I saying? What's the word I'm looking for? Inspirational, like a lot of people like to see changes in their body, because it's,
Yes.
if you're just,
Yes.
what am I doing this for? If you're not seeing the health benefits, but if you're doing something like that and you see in real time, wow, what this
Right.
does for
Right.
you.
So I had a couple of clients who actually did it, and a friend who did it with me. And but she did go from eating like me to making poor choices because she could still get the score. And so
Wow.
while it was a wonderful learning tool to me, to see, I really liked wearing the continuous glucose monitor, which is totally against natural healing. You're sticking something in your skin and everything. But it was really neat to see, how different foods affect your blood sugar, which, we're talking about metformin. And so some people, they get put on it when they have prediabetes. And so, we're going to go ahead and put you on the metformin. Or I had someone come to me that had PCOS, and they had put them on metformin just to help with symptoms and things. And I thought, why not teach healthier ways of eating and find out, like, so if you have prediabetes, why are we going ahead and putting you on metformin instead of teaching you ways to prevent getting diabetes? There just doesn't seem to be any prevention in the conventional world, where in natural healing, this is a lifestyle. We're looking at the whole realm, everything from your sleep to your exercise, daily movement, relationships, and things like that. I don't know.
Yeah, the modern medical system, it's really good if you get in a car wreck, you break your arm
Yes, yes,
or some other accident, but if you come in with high blood pressure, heart disease, diabetes, they're going to throw you on a pill. They don't teach you anything about prevention or reversal. They'll tell you that food doesn't matter.
right, right. Well, in my own case,
Yeah.
food and lifestyle have nothing to do with it. That's what I was told, and it's like, how can that be possible? And I even heard I don't remember who it was that was talking, that said, how can a doctor who works with patients with colon cancer, how can they not think that food is related to this?
I do not know. It must be, it has to be some kind of brainwashing because there are studies. I saw a study for colon cancer. It's with African Americans from that live in America, and then Africans actually live in Africa. Okay. And the Africans in Africa eat more of a plant-based diet. And the African Americans eat a heavy meat-based diet.
Hmm.
And they were taking cultures of their colon cells, and the people eating the heavy meat-based diet already had signs of colon cancer development. The
Hmm.
people on the plant-based diet had very little signs of colon cancer. And then they switched them. They put the plant-based eaters on a meat-based diet. It went in 3 days, they started showing markers for colon cancer. But
I
when you
saw
switch
that
them back
study.
to plant-based, it started those the those signs started to go away again.
Right, right.
What? I mean, are they not reading this? I thought that was their job. I mean, no.
Well, then we have to think about that too. So I think I saw it takes 17 years for a study to appear in a medical journal. And
Yeah,
so someone today is learning research that actually came out 17 years ago, not what is coming out today. And once they are out and practicing, I mean, they have so much they have to get done during the day, so many patients they have to see, to even just pay the bills, and then their continuing education credits, they have to get those. But it's not going to be everything. It's just going to be honed in on one thing, and probably whatever is specific to the new surgical procedure or the new meds or whatever, because who's writing the continuing education classes too.
yeah.
And so I
All
forgot
right.
where I was going with this, but
Well, it's just you're
that's
going
why
with,
that's why the doctors they're not up to date with the new medical research. So it's not their fault.
yeah, it's
Uh,
not. And if they were to push alternative therapies to what they teach, they could actually get in trouble, get their
right.
licenses pulled.
Yes. Yes.
So, well, and then they only get like 5 minutes with each patient.
Right.
Like,
Right.
so there's like, take this, you know, it's crazy.
Right.
This system needs to be changed. It needs to change. I don't know. I think that, well, another problem is practitioners like you and I, we're afterthoughts. You know what I mean? Like, people only come to me if they've been through everything in the medical system
They've
and
done
it
all
didn't
the
work.
things.
Yeah.
Hmm.
Then they come to me like, well, can you help me? They're already, I don't know if this guy can help me.
Yeah.
I
Right.
don't know.
Right. And then when they come to you too, what is so for me, when someone comes to me, I usually will delay the first appointment, which sounds ridiculous, but it's just because I want to make sure that they're really all in. They're
Yeah.
really willing to try and really willing to make a change. Because I could, right now, if you call me, you just left your doctor's office, you're frustrated with what your doctor said, and you call me and you want me to help you right now, you're looking for a quick fix. And
Yeah.
so if I give you, a week to think about it, then, are you still looking for a quick fix, or are you ready to dive in? You've had a week to think about it. You've had a week to do your own research, which is great too. And then we can start working together to make changes. And I also ask, one of the first questions when I do like an interview, I do like a consultation, a free consultation, just to see where we are,
Yeah.
what is your need? What could we do together? And one of the questions is, how willing are you to change, diet and lifestyle? Because that is so important. You have to make a change to get a change.
Yeah. They had to, it's a good policy you have because they don't understand that unless they make drastic changes, they're wasting their time, you know?
Right.
So,
Right. Right. If I add, I don't know. You can't. Yeah. I get frustrated too. I get frustrated too. Yeah. Instead of keeping going deeper, let's talk about the positive things with natural healing. So you talked about with the conventional medicine, have you have an acute trauma,
yeah.
definitely you want to go to the hospital. You break something, you cut something, you well, you don't even have to go for cutting in some cases. Maybe cut a finger off,
Yeah.
then
Yeah.
yeah, you want to get that fixed. With those acute conditions, you definitely want to go to the hospital. We didn't even say a disclaimer when we started today in our conversation, but everything we're talking about today, this is educational,
Oh,
completely
yeah.
educational. Please run this through your own medical provider. We are not diagnosing, we are not treating, we are not telling you um, what you should do in your particular situation. Please just use this as educational.
Yeah.
Um, so where was I when I was thinking of that? Okay, and so go to the hospital. If you get shot, go to the hospital. You get in a
Oh,
bad
yeah.
car accident, go to the hospital. um, but there are some acute situations where you can use natural healing. So like if you cut your hand, if you have a cold or a flu's rampant right now, you know and things like that. So what are your suggestions, if you have some of these acute conditions?
Well, like for example, you remember in the class about if you get burned really bad, like
Hmm.
the burn paste, which was the raw honey and comfrey and wheat germ oil. Do you remember
Right.
that one?
Yeah, I completely forgot about that one.
Yeah. A lot of
Hmm.
these things, if you really want to get into the world of natural healing, it's good to have already get these, have a herbal medicine kit at home.
Right.
So if this happens to you, you can try these.
They're already here. Yes, I
Yeah.
know. I keep all the different herbs, but you don't have to buy them all at once either. You know, they can be expensive, but
Oh
just
yeah.
gradually, like this month I'm going to buy this. And if you buy a pound of herbs, I mean, you can get a hefty bag that will last you a long time. It's just, making sure you store it correctly so that you don't lose um, the value there, or get, whatever size you need. But I have a huge stash now, but it took me a long time to
Yeah.
grow that. But honey and
Oh
wheat
yeah.
germ oil,
Yeah.
you know, yeah, you should already have those, right?
Yeah, those are
Now,
easy.
which is something we didn't talk about. So we were talking about vegan food and eating raw vegan, but I don't consider myself vegan. I whole food plant based. So I do use honey. I do like
Yeah.
honey, and
Yeah.
that doesn't really fit the vegan
Yeah.
lifestyle. Vegan's a lifestyle, not a food choice. Um, I
Yeah.
mean, people use the words interchangeably, but I just wanted to say that because that honey is wonderful for all sorts of things. I know, actually, a family member has the flu right now and called me last night. What is it that I use? And I said, you need honey, you need garlic, and you need cayenne. And so,
Yes.
those you should already have in your house, right? I mean,
Yeah.
I always have those in my house. I don't have to go run to the store to get them. Yeah, and so things like that, like, so my husband hopefully doesn't mind me talking about him, but he was sick. He works alone, but he drives around town a lot, and so he keeps garlic cloves in his truck.
Yeah. Yeah.
And so if he's not feeling good, he just will kind of break a clove and swallow it like a pill. And so
Oh, garlic is
yeah,
excellent. It's
it's
called the poor
wonderful.
man's penicillin.
Yes. Yes. And I think that we learned too that in studies it is as effective as penicillin, but no one's going to tell you garlic because I can't patent garlic. I can't.
Uh, yeah.
Yeah, I mean you can grow garlic in your backyard. Yes, but garlic is wonderful, and it provides fiber and minerals and sulfur, which helps with detoxification of the liver. I mean, they're just it's wonderful for the heart. I mean, there's so many benefits to these foods that can also help with acute conditions.
Yeah, garlic has like 80 different types of sulfur in it. And they used it during
Right.
World War II to they ran out of antibiotics in World War II. I think it was the Russians or the Germans. I can't remember. It was the Russians. So they started after that they started using garlic to treat battle wounds. They would take moss and and put raw garlic on it and put it on the wound, and
Hmm.
they had less infections using garlic than they did with the antibiotics.
That's
And
amazing.
yeah,
Hmm.
I think it's 3 cloves of garlic equals 1 dose of penicillin.
I
Or
can't
adult.
remember exactly what it was, but yeah.
Yeah.
Yeah,
But
I always recommend. And if you have something like a cold or flu, then I say, take it frequently. If
oh yeah.
something's coming on fast, you want to attack it fast.
And that's another difference between natural healing and the medical systems. If we have the flu as natural healers and our fever goes up,
Oh,
we
yeah.
like to work with the fever instead of trying to suppress it like the medical community does. A lot
Yes.
of people think that's crazy because a fever can kill you. Well, it can, but we were taught that a dry fever kills, but a wet fever heals, meaning if you continue to hydrate yourself with water and herbal teas, the fever will never get out of control where it will damage your body, but you have to keep drinking.
Stay hydrated.
Yeah.
Yeah,
And yeah, the body works better when it has a fever because the immune system is working in overdrive when you have a fever. So
right. And so what do you say if someone says, I'm not feeling good, I feel awful, I have this fever, it's 100 degrees.
what I tell them is get well, you already have this on red raspberry tea. Go
Yes.
to your teas and your juices. It's really, if you want to heal relief, it's not good to eat solid food when you're sick. People think, oh, I need a steak when I have to have flu.
Wrong.
No, your body has to work on digesting that steak and takes all of its energy to digest the steak instead of healing the flu. You should go to a
Right.
liquid diet, water, juice, or herbal teas, and with flu, I would take garlic, maybe some, I like oregano oil. I know that we didn't,
Yes.
oregano oil is a great one for flus and colds and any
Yes.
kinds of infections.
Mm,
But yeah, I recommend fasting for at least well, not fat, a a liquid diet.
yeah.
Because for
Yeah.
me, even a juice fast, I like to call it a juice diet because you still want to get enough calories. You know what I mean? Like a lot of people go on the juice, and I'm going off topic again. I'm sorry, but you
It's
should
easy
do
to do.
a liquid diet with garlic, cayenne pepper, honey, like you were saying. That's a good one for also for strep throat. Those three
Yeah.
herbs. You can make a
Right.
paste.
Hmm.
What do you tell them for the flu?
For the flu, the same thing. Yeah.
Yeah.
Yeah. Lots of juices. It's more about being comfortable. If you have a fever, then, keep an eye on the fever, but,
Yeah.
but stay comfortable. And we want to focus on restoring the health. So when we talk about juices, um, I know at the School of Natural Healing, we did use a lot of fruit juices and green juices, but I think it's more important to have the green juices. If you have a cold and flu, apple juice um, is very sweet, but it
Yeah.
does have a lot of fabulous nutrition in there as well. So if someone does have apple juice, I wouldn't have more than like 4 ounces
Yeah.
in a day because while it does have wonderful benefits. We don't want to spike blood sugar and have the body working on that. We'd much rather have all the minerals coming in from the greens. Your green juices have tons of vitamins and minerals, where your fruits don't have quite as many minerals. Um, but even apple juice is healing, and it can add some sweetness. So if you have someone who's never had green juices,
Yeah.
adding a half an apple to the green juice is going to, or eat the apple while you drink the green juices to activate the enzymes in the mouth, to slow blood sugar response, to add some fiber to keep the bowels moving, because
Yeah.
that could be something too. You stop eating, then you stop going to the bathroom. And when you're sick like this, we definitely want everything to be removed. We're killing, your body's fighting, and it's killing, the bacteria or virus, the flu, it's a virus, but it's killing it. It's got all these byproducts. We want to get those out of the body. We don't want them to be reabsorbed in the colon because you're not pooping. We need them to come on out. And so eating the apple, which is full of wonderful pectin, that can help to stimulate, and the chewing stimulates the bowels too. So yeah, I just think it's important to keep going to the bathroom, drinking all the herbal teas. Red raspberry is one of the highest in minerals, or nettle tea, nettle and peppermint tea. I know with at the School of Natural Healing, we talked about yarrow,
Yeah.
for sweating, to
Yeah.
keep, but you have to stay hydrated as well. So we want to sweat out toxins, but we want to replenish that as well. So drinking plenty of tea like that.
Yeah.
Yeah.
And what you were saying about always keeping the colon and the organs of elimination open, I think Christopher, with the flu, he would give him an enema to start, like especially with
Yeah.
little children. You remember, like he would give him a catnip enema to
Yeah.
start the process because he said, because in our school we're taught that flus and colds is really a symptom of toxicity
Right.
the body's trying to get rid of, and that's how it tries to get rid of it.
Right.
And
Right.
so if we're constipated, it can't get rid of it.
Right.
So
Yeah.
another
So
thing we can take is if we're having trouble, like eat our fiber, our apples, and even take some herbs that can help your colon move if you need to,
right.
which red raspberry is good for that. But
Yes. So that made me think of something.
yeah.
So in the pandemic, there are so many
Uh-huh.
people who are asymptomatic. And
Yeah.
so I wonder if the people who are asymptomatic are the ones who they have clean bowels. I don't know how
I
you
would
would
believe.
study that. I know PCRM said, had studies that said people who eat plant-based have less chances of long COVID than
Yes.
people who are not plant-based. And so that's interesting, to think about that, because they're eating a lot more fiber, things are moving along. So it makes a lot of sense.
It does. I mean, that was like, I mean, the point drilled to us is the colon, you have to have the colon moving if you want to get healthy. But if it's not moving, you
Yes.
cannot, no healing routine is going to work as well without the colon moving. And you're saying,
Right.
I think there's a lot to do with people on plant-based because if you were to compare a plant-based eater to a meat eater, they're going to have probably at least I'd say 2 bowel movements a day, plant-based. A
Mhm.
meat eater might have 1 bowel movement every 3 days,
Right.
but you go to a medical doctor, they go, "That's okay." Like, "No,
Yeah.
it's
That's
not."
normal.
Yeah, well, that's normal, but it don't mean
Yeah.
it's ideal, you know?
Right. And pooping wasn't one of our part of our topics today, but I think it is important for people to know, just like when you're training a puppy or you have a newborn baby, you feed them and then what happens, 30 minutes later, they need to go out or you need to change a diaper. And that's how we should work. We have trained
Yes.
ourselves, in school, you can't go during certain hours or it's embarrassing to go. Or, I was a teacher in a middle school where the kids had to ask me for toilet paper, and so I
God.
mean, that had to be so traumatic for these kids.
Yes.
And
That's
so I
God,
yeah, raise my hand in front of the whole class. I need the toilet paper.
that's
That's
ridiculous.
yes. Yeah. So anyway, is we're taught not to poop. And so we learn to hold it, we learn to train and we stop going, or we eat foods that cause constipation and keep us, or we take medications that cause constipation. And then to fix it, maybe we take laxatives, which can be addicting. And so then you're kind of stuck in this loophole instead of flushing. And so I want to remind people, so why does this happen when you have a puppy or a baby? Why is it that they go to the bathroom 30 minutes later? It's because when the stomach swells, the nerve endings get stimulated to the ileocecal valve, which is in your lower, where your small intestine connects to large intestine. And so that opens to move things along, and then things get moved into the rectum, and then hello, you get the signal that you need to go. And so every time you eat a large meal, you shouldn't get that signal. And so it's important to get the bowels moving and to restore those nerve endings and things too, to to get that process moving again. So I just want people to know, if you're not going after every large meal, that's something you may want to start looking at, getting that moving, and not taking laxatives, but taking herbs that
Yes.
can help, that are not going to be addictive. They're going to help to restore those nerve endings, help with motility, help heal your stomach lining too, because if food's sitting in there, you've got toxins sitting in there that's going to be changing your cell structures. And then we start developing polyps and cancer and things like that.
Great point. We in this country, we train ourselves not to poop, and it's
Right,
horrible, you know?
right, right. Yeah.
I was reading an article about primitive cultures that eat like a plant-based diet. I think it's like after every meal, they have a bowel movement about 30 to 40 minutes or an hour after a meal. And that's the
Yeah.
way we're supposed to be. And how many I'm not even like that, but
Right.
because for the first at least 34 years of my life, I lived like a typical American. I had a
Mhm.
heavy meat-based diet. I thought you needed
Me
it for
too.
protein
Right,
and I've been
right,
plant-based now for about almost 10 years, but I'm still not where I want to be with my health.
right,
So
right,
yeah, that's another thing. And a medical doctor is not going to talk about pooping, but that's one of the biggest difference between medical doctors and natural healing mindset is you have to poop, you know?
right, right. And speaking of that, so you said you for 34 years you didn't eat this
Yeah.
way. And so for me it was 40, it was at least 40 years. Well, for me it was very gradual. Like we went
Yeah.
to one day a week, no meat, and so it was very gradual. So I don't really have a set. I know it was completely whole food plant based in 2017, so 5 years ago. Completely clean whole food plant based. But that means for 44, 45 years, I was still eating things that are harmful or inflammatory. And
Yeah.
so change, even though it's been 5 years, well, if it took me 40 something years to create a health condition or make those changes in my body, it's going to take a long time to undo those changes. And so there are no quick fixes. We can repair it and prevent things coming up. But that's, it's like someone who comes to me and they go gluten free for a week and say, well, it didn't work.
Oh yeah. Yeah, I get that.
Yeah.
People are impatient. Yeah.
Yeah. It can take 6 months to a year for some people, depending on what's going on and how long they've been damaging the system.
I saw a study showing that it can take up to a year or more for your body to get rid of gluten. And I guess it
Yeah.
gets into the cellular structure or something because
Yeah.
I could not believe that. I'm like, really?
Yeah.
So it's not like, well, today I'm just going to cheat and have a little bit of wheat, but then when I saw that could take your body a year to get, it's like,
Yeah,
it's not
you're
worth
setting
it.
your right. Right. You're
Yeah.
setting your body back that much.
Yeah.
This cheat meal is undoing.
And people out there, you need to think, is this meal worth me not feeling good, being
Right.
sick? If you're sick, the quality of your life is not going to be satisfactory. Let's just put it that way. You're
Right.
going to miss out on living. If you, I know people that are ill, and most of their days are sitting at home on the couch because they have no energy.
No energy. Right.
That, they're a lot. They have, the quality of life is zero. So you have to wonder, is it worth eating a Big Mac and feeling that way? You know,
Right. Sorry, I have all these dings coming in.
you do. I don't even know how
uh,
long we've been talking.
oh yeah, we probably are running out of time. We should probably close today. But I think that this has been a great
Yeah,
start to natural healing.
yeah.
There's so much to talk about.
Oh,
And
I know. It's
yeah, we'll just keep going deeper and into different systems and start moving into um like next week, why don't we talk more about why we eat this way and how we think how it fits into the natural healing.
definitely, that really makes sense
Yes.
because people, they want to know, what am I going to get out of this? Is it worth it?
Right,
And
right.
it will tell, it is worth it. Yes, we'll tell you
Yes.
why next week.
Yes. So we will put in the show notes how you can connect with us. Please comment and share and let us know what else you would like to hear. Do you have anything else you would like to end with, Daniel?
No, I just hope that everybody had a great week, and I hope they have a good weekend, and I hope they start to think, just, I hope we planted a little bitty seed today. If you're out there and you're not as healthy as you want to be,
Mhm.
there is hope.
Yes.
We can
Yes.
never give up hope. Hope is what makes life great.
Yes.
So,
Okay. Well, thank you and to your health.
you too.